Thank you. Senator Cassidy.
Thank you all. Dr. Durham, great to see you.
Great to see you as well.
For my colleagues, Dr. Durham is a former student, and despite my training her, has done very well. And is the only one in the room who recognizes that I'm wearing a Mardi Gras tie. Having trained in New Orleans, everybody else thinks I can't match colors. Dr. Durham, you mentioned you opened a 56-bed facility. Now, I understand that Massachusetts has a waiver from the IMD exclusions. And you know, IMD, which says that you can only have 16 beds in your facility. And the issue here is both cost, but the perception of going back to the bad old days when we just put people in a big warehouse of the mentally ill and not let them out. But you mentioned as a positive that you're going beyond the 16 beds to 56 beds. Can you speak to the importance of that waiver or that ability to go above 16? Because I assume these are Medicaid patients.
Yeah, many of them will be, thank you, Senator Cassidy. Again, good to see you as well. Many of them are Medicaid, Medicare, and we do see a very small number of privately insured folks at BMC. But the BMC is a large safety net hospital for the city of Boston and beyond Boston, and we have never had our own inpatient psychiatric unit. So that has caused increased boarding in our own psychiatric emergency room and our emergency room period for decades. So a big investment of the hospital is like, where do we send our patients who are on Medicaid or Medicare? Because many of the facilities in and around Boston are also full and at capacity. And so it was an investment for our patients, essentially.
So just to be sure, unlike the kind of stereotype and the criticism that if you go beyond 16 beds, you're just warehousing, here you find that you're able to provide needed services that otherwise would not be available, correct?
I'm not familiar with what you're talking about exactly, but what I can say is that we do need a continuum of care for mental health.
Sounds great.
So we need investment in community, in intermediate resources, and an inpatient level of care, so across the continuum.
And over 16 beds allows you to get an economy of scale as well as to provide more services. I'll add that editorial because that's something for we policymakers to consider, just to say that. Dr. Lockman, in your full testimony, you mentioned the telemental health bill that we're trying to push out. Can you kind of comment upon the ability of allowing telemental health to address the person power shortage of providers that was previously referred to?
Absolutely. So when the pandemic hit at Centerstone, we had never used telemental health widely, and we couldn't actually find research to understand the degree to which it would be effective, particularly in our population. Our population has a lot of community-based needs, a lot of psychosocial barriers, and there was a great need to be able to reach them quickly. We have done our own research in terms of, and actually in part through the SAMHSA grant, so we're so thankful for that federal funding. And we have seen that providing services via phone or telehealth has about the same outcomes as being seen face-to-face. This has allowed us incredible mobility during the time of the pandemic. It's allowed our providers to see more patients. And it's also allowed more people to come and have better access to care that really transverses a lot of psychosocial barriers.
So I'm running out of time.
Sure.
To cut to the chase, you would highly recommend that Congress pass my bill.
We highly support telehealth services and phone-based services for mental health provision.
Sounds great. Dr. Prinstein, you highlight the importance of programs such as the programs for children with a serious emotional disturbance, which Senator Murphy and I were able to get passed as part of a bigger piece of legislation, and the Community Mental Health Block Grant targeting funds at children with serious emotional disturbances. Now, we've heard from states that because it is perceived in the regs that the child has to have a diagnosis of serious emotional disturbance before they would qualify to benefit from these funds, that we should make it clear that the funds could be used for preventive services to prevent a child from developing SED, if you will. Any comment on that?
Yes. First of all, thumbs up on the Telemental Health Improvement Act. Excellent. Science supports that is working. Second, yes, there's a huge backlog right now for folks who are waiting to get an individualized education plan from a school psychologist, sometimes waiting years until they can get that diagnosis so they can access those funds. So I agree that having the ability to access those funds for preventive services would be fantastic.
Okay, I'm almost out. Ms. Rainier, thank you so much for what you do. As someone whose family's being affected by suicide by a young person, I'm sorry to be emotional. Thank you. I yield back.
Thank you. Senator Murphy.